Coming up on this episode of the Concussion Game Plan podcast.
You can imagine that the inflammation that occurs in the meninges after a concussion can activate these pain-sensitive nerve endings, just like that.
Hey everyone, it's Dr. Chris Nowinski, co-founder and CEO of the Concussion Legacy Foundation. Welcome to episode 2 of the Concussion Game Plan podcast. We created Concussion Game Plan to give you the information you need to set yourself up for a complete recovery, but also to prepare you and your loved ones for the challenges that you may face. Today, we're bringing you part 1 of our 2-part series focusing on the physical symptoms of concussion. Think headaches, dizziness, nausea, light and noise sensitivity, and issues with sleep. We want to help you understand why you or a loved one may be feeling the way you do and what you can do to feel better. Most of all, we want you to know you're not alone.
First of all, headache is the most common symptom after concussion.
Dr. David Dodick is professor of neurology at the Mayo Clinic in Scottsdale, Arizona. He also directs the Concussion Clinic there and co-chairs the American Academy of Neurology's Concussion Committee.
At least 90% of people who are concussed will have a headache, and oftentimes it will be immediate. Sometimes it can be delayed, like many concussion symptoms that can evolve over the hours to days after a concussion. Now, why it happens from a biological standpoint, we don't really know. However, you can't have headache without activating what we call the trigeminal sensory system. So there's a nerve called the trigeminal nerve. And this trigeminal nerve sends millions and billions of little nerve endings into these pain-sensitive areas. And we know that these pain-sensitive areas are injured during a concussion. The first thing that's injured is the capsule over the brain, what we call the meninges. And the meninges is sort of like the skin of an apple. You know, if the brain's an apple, the skin on the apple are the meninges. And the meninges are one of those pain-sensitive structures in the human body. And we know that there's intense inflammation within the meninges, and some very soon after a concussion. So you can imagine that the inflammation that occurs in the meninges after a concussion can activate these pain-sensitive nerve endings, just like that, and you get headache. When these nerve endings are activated, they too release substances from the nerve endings that further activate those nerve endings. So it's kind of a vicious cycle. And if that's allowed to progress, then the headache becomes entrenched and it can stay for days or weeks or months. So that's one mechanism whereby headache can occur. The other mechanism, of course, is that we have an area in our brains where the trigeminal nerve comes into the brainstem. It's kind of grand central, and pain signals are sent up from grand central to the cortex where it's registered as pain. Normally, grand central, there's a brake on it. It's inhibited. Right? Otherwise, we'd always have headache. What happens is that inhibition or that brake is lifted after a traumatic brain injury, because all of those descending fibers in the brain that come down, that keep a brake, that keep the pedal to the metal and keep a brake on that grand central from firing, is all of a sudden lifted. And so that's another mechanism whereby headache occurs. So you have a lot of traffic coming in from activated trigeminal nerves, and you've lifted the brake, which allows those signals just to propagate up and be registered as pain.
Like Dr. Dodick said, headaches after concussion are often immediate, but they are a symptom someone is feeling and not a sign anyone else can see. For Toronto-based writer Carla Ciccone, they were a pain she initially tried to hide.
So at first I was kind of like, oh, it's fine, like as my headache's just getting worse and worse and I'm getting blurry vision and I'm confused and I'm trying to be like, oh, it's fine. And the people across from me saw and heard the impact. And they're like, are you sure? Because that was like, we heard that.
Carla looks back now on the concussion that changed her life nearly a decade ago.
But I happened to be sitting down at a restaurant. It was celebrating like a friend of a friend's birthday. And we were all eating out and it was the end of the meal. We'd all had dessert. Everything was wrapping up. And all of a sudden, I felt it felt like a brick got thrown at the back of my head and kind of went down. And like, I wasn't completely knocked out. I was seeing stars and like kind of like a cartoon character might, but I turned around and there was just a busboy with a stack of plates and he felt so bad for hitting me. I didn't want to make a big deal of it. So I was like, please don't call an ambulance. And that night I didn't go to the hospital or the doctor. I went home and went to bed, which probably wasn't the best idea in hindsight, but I really didn't know that I had a concussion. It wasn't until the next morning I woke up with the worst headache I've ever had and experiencing a lot of typical concussion symptoms like blurred vision and vertigo, and I couldn't look at any screen for even like a minute. And being a freelance writer, it prevented me from doing my job. The headaches were pretty constant. They were kind of local. I got hit in the back of my head, so it was a pain that started in the back of my head, but kind of went all the way around. And I did take pain medication. I took Advil constantly, but it didn't actually make too much of a difference.
Most of the time, doctors don't end up treating post-concussion headache because for about 70% of concussed individuals, the headache goes away within a week or so. But in some cases, Dr. Dodick believes it's best to treat the headache aggressively.
Number one, you don't want people in pain. And number two, while we can't necessarily predict who's going to go on to develop persistent post-traumatic headache, we know some risk factors for that, but not all. We want to make sure that the brain doesn't get used to processing pain, because once it gets used to processing pain, it may just continue to process pain. I happen to be in the school of thought where we treat headache and we treat it aggressively, because if I treat it aggressively up front, and that might prevent some people from going on to have it persist. Some of the medications that we use early on are non-steroidal anti-inflammatory drugs. Why? Because they're effective in relieving pain, because they may reduce or suppress the inflammation that occurs after concussion. And as long as the individual doesn't have any evidence of bleeding, which the overwhelming majority of people with mild traumatic brain injury or concussion do not, the non-steroidal anti-inflammatory drugs are safe.
A bad headache can make it very difficult to get through school or work, making it easy for practical worries and stress to seep in.
It was kind of like immediate for me that got into a dark place mentally and emotionally, because I suffer with depression and anxiety anyway. And so it just kind of made everything so much worse because I had none of the usual supports that I normally rely on. I couldn't go outside and go for a walk. I couldn't watch TV. I couldn't work, which was a big one because I was losing income. So the worry of like not being able to bring in money was a big one.
It's quite stressful and anxiety provoking to have your life completely turned upside down. Meditation, biofeedback, relaxation therapy, all of these things can be helpful, not just for the headache, but for other symptoms that, athletes and other people experience during that post-concussion phase.
Beyond headache, dizziness, nausea, and balance problems are very common symptoms after concussion. For Carla, even walking around her apartment was difficult.
I had, in the weeks right after the concussion, persistent headaches, nausea for sure. I had vertigo really bad. I couldn't walk straight for a long time. I had really bad eye strain, which kind of goes hand in hand with the headaches. I stayed in my apartment and didn't really venture out very much. And I had to rely on like holding onto walls and stuff to make it to my kitchen and make it to the bathroom, because it was just everything was kind of spinny and I was wobbly.
For those of you who have been dizzy, you'll realize that it often comes with nausea and you often feel, off balance. So that's why this is kind of a constellation of symptoms that cluster together. But dizziness itself can be due to a couple of different things. First of all, vision is impaired after concussion. So we know that the majority of the pathways in the brain are actually dedicated to vision and to the control of your eye movements. And because that's often impaired after a concussion, if what you're seeing is not registering appropriately in your brain, that can cause a sensation of disequilibrium or feeling off balance. And because the oculomotor system, as we call it, or the system that governs or manages eye movements and vision, is intimately hooked up to what we call the vestibular system, the system that maintains balance, there's a mismatch of what's coming in from our ears and feet and what's coming in through our eyes, and that can create the sensation of dizziness. The other problem is that sometimes the inner ear organs that we call it the vestibular apparatus or the vestibular system can be damaged from a head impact. So when people have vestibular dysfunction that leads to dizziness and unsteadiness, it can be due to damage of the vestibular organs themselves outside of the brain. And because we're dealing with a traumatic brain injury, it could actually be due to problems inside of the brain. So it's what we call peripheral versus central vestibular dysfunction. Either way, it's damaging in some way or impairing or disrupting the normal control over the vestibular system, and that can lead to dizziness. The other thing that can lead to dizziness is what we refer to as autonomic dysfunction. So autonomic dysfunction is pretty common after a concussion. What is autonomic dysfunction? I like to tell people that the autonomic nervous system is like the automatic nervous system. We have a nervous system, a parallel nervous system, if you will, that controls things which are normally involuntary. Blood pressure, heart rate, breathing, motility of your gut. We don't control these things. They're controlled basically for us. And it so happens that after a concussion, a very common problem is a problem with this autonomic nervous system. So very labile or fluctuating blood pressure, heart rate, and that can cause dizziness. So one of the first questions I ask people is, when I'm taking a history about dizziness, I say to the person, is the dizziness like a lightheadedness that comes when you stand up or when you sit up? Because that could be not due to damage to the vestibular system, it could be due to dysfunction of the autonomic nervous system, which is a completely different animal that requires a completely different treatment approach. So it's important to sort of dissect out, when someone says dizziness, they could be meaning any one of a number of things, and it's important to generate a differential diagnosis and to determine exactly where the dizziness is coming from, because that's going to determine how you're going to manage that. Because this vestibular system is linked up with another area in the brain that can lead to nausea, that's where the nausea and the sometimes vomiting comes from. So sometimes, the brain is a complex network and things are interconnected. So if something goes wrong with one area of the brain, it can cause problems in another. And that's why nausea is such a common symptom in people who have dizziness, because the areas of the brain that are responsible for dizziness are inextricably linked to areas of the brain that control, that are responsible for generating nausea and sometimes vomiting. The other thing I will say is that nausea can come also as a manifestation of headache. So, if you have moderate to severe headache, you're probably more likely to be nauseated. So recognize the fact that nausea can come from different sources. And I guess the final thing I will say regarding dizziness is you have to assess the neck. Sometimes people who are concussed may have had a whiplash injury as well. And we have this nervous system called the vestibulospinal system, whereby, nerves in the neck hook up with this vestibular system that I talked about. And so just a whiplash injury of the neck and problems with the neck can actually cause dizziness.
Dizziness and nausea can be very difficult to deal with day to day. But the good news is there are treatments available.
So some of the treatments that people may take advantage of if they're suffering from dizziness and balance problems is, once we've figured out where the problem is coming from, if it's coming from the visual and oculomotor system, for example, then sometimes vision therapy or, eye exercises can be helpful. So we call it, oculomotor integration, convergence therapy. So sometimes vision therapy, it's all clumped under vision therapy, can be helpful if the problem is coming from the visual system. Sometimes physical therapy and treatment that is directed towards the neck can be helpful. And then sometimes, we take advantage of some of the physical therapists that we have who do vestibular therapy. So exercises to sort of facilitate the ability of the vestibular system to adapt to the injury and to recover from the injury.
If you take away anything from this episode, I hope it will be that symptoms you may be experiencing are real, your pain is valid, and there are treatments that can help you feel better. If you're looking for help finding a provider like Dr. Dodick who can prescribe those treatments, reach out to the CLF helpline. Our staff provide free, personalized support to those struggling with brain injury symptoms. We'll help connect you to care and resources in your area. You can submit a request for yourself or loved one at concussionfoundation.org/helpline. That's a wrap on part 1 of our conversation with Dr. David Dodick and Carla Ciccone. A special thanks to both of them for joining us. Be sure to tune into part 2, where we'll cover symptoms like blurry vision, light and noise sensitivity, and difficulty sleeping. Plus, Carla has excellent advice on how to stay positive throughout recovery.
Normal life will resume. It might look a little bit different, but you'll get there. and just be patient with yourself and go really easy on yourself.
Until then, I'm Dr. Chris Nowinski. Keep fighting.